Welcome everyone to our latest edition of the Native Strong Town Hall. Sorry for the late start here. We had a couple technical difficulties. Our emails have been down, phones are off the hook today. We're holding our vaccine event, and so it's been pretty crazy. So anyway, if you've been here before with us, welcome back. Jump on anytime and ask a question in the chat bubble via Zoom if you're checking in that way. Otherwise, if you're joining in via Facebook Live, just drop in a comment and we will moderate those as we move along today. As per usual, our great friend Mark Denning is here with us, helping us moderate and bring his viewpoint from the community. And so with that, I will try not to waste any more time and get right into it. Mark, thanks for being here again with us. Take it away.
Winabuju and Maganiduk, Adaway Benezi, Indigenous cause, Namendo Dem. Anishinaabe and Dao Neopit in Donjaba. I don't often get a chance to explain a little bit about what I'm saying. Some of you understand, I get that, but it's just that greeting to all those things that are in and around us outside of my window here, to the past, our present, future, that kind of thing. And then my name is in there, my clan. And I use that word Anishinaabe, and a lot of folks kind of when they hear it, it's specific to a certain group of folks, but in other times when we use it, it's a general umbrella term for our people, our native people, Aboriginal people, Indigenous people. So when I use that term Anishinaabe, for me as a person, just within myself, I'm including the 6 different federally recognized tribes that I'm descended from, and certainly French and English. The last part that I share is where I am from, and that is a small town called Neopit, Wisconsin, on the Menominee Reservation. So I just wanted to share that because someone asked me last week, you know, when I'm saying a greeting, what is it exactly that I'm saying? And I'm making this assumption because we hear it so much around Milwaukee, that particular language, that we kind of have an idea of what's going on. So much apologies for not explaining that before. And also for each of you that are here, we're doing an abbreviated show today because of these vaccine marathons that are happening for our community and the communities that we are a part of. I liken this to, in our Milwaukee community, we started last year on actually the day of the George Floyd killing, Unity Fire. And those Unity Fires, the very first one, we lifted up the voices of other people. And that is exactly what's happening at the health clinic right now, is lifting up not just Native people, but other populations as well, because that's who we are. It's not just about us. It's about our neighbors, the people we live with. And it is Native folks as well. And we were prioritized in the first and second rounds of these mass vaccinations. So much appreciation to Dr. Ignace and the health center there. For those of you that are tuning in here, we do have that chat bubble. If you move your cursor around, you'll see a bar there and it'll say chat. There's that little window, just click on that where it says chat and you can put your question in there. And I think you might have a lot of questions, especially right now. Some of you have had your first shot. Some of you have finished that second round. So much appreciated for your input and your experiences with those to help others. We're going to have an abbreviated show today. We're probably going to go about 30 minutes from this point forward to make sure that our host here, Dr. Ignace, has time to be attending to those folks that are coming into the clinic on this last vaccination day for this week, this mass vaccination day. So without further ado, Dr. Ignace, you are on and welcome. And again, apologies to all of you that patiently waited. We do appreciate you being here, and please share what you hear in our program. Dr. Ignace?
Thanks, Mark. Thanks, Jeremiah. I'm actually using Jeremiah's office right now. I'm really active today in our vaccine event, so it is, to say the least, been very busy today. And but I All right, not my computer. Someone's driving. I'm driving. All right, so some quick highlights. So this is our second vaccine event this month, and March 23rd, 24th, 25th, we certainly opened this up to include a very big part of Wisconsin, as far as Green Bay to Chicago, and from Milwaukee to Madison. We've been taking online registrations, phone calls, and it has been a very busy 3 days. We've had people as far away as Chicago, from Madison, Rhinelander, Superior tribes from all over the state and throughout the entire country that reside here in Milwaukee County have been coming to Glick to get their vaccine. So it has been extremely successful. We're absolutely proud to be able to offer the vaccine to enrolled members, descendants, and their households. And it's been quite a quite amazing story for the last 3 days. So I'm part of the observation team today, and I go through and I talk to people as after they've gotten their vaccine, kind of give them a little bit of discussion what the vaccine is and what to expect, or at least anticipate in terms of symptoms and what they could anticipate in the next day and what they can do to kind of help alleviate some of these symptoms. So we are giving Pfizer today, and Pfizer, it's been going extremely well. I let people know there's going to be a little injection site pain, discomfort. They may feel a little achy, cold-like symptoms, but that usually resolve within 24 hours. Put an ice pack on the area you get the shot, and then take some Tylenol if you feel, and maybe even ibuprofen if you feel you need something a little bit more. So it's important to realize, given in this time of vaccination, and for individuals who get vaccinated, is what does the CDC say beyond this point? So we're getting more and more individuals vaccinated now, and what does that mean for interaction? And so households right now, we know people who've been vaccinated indoors, that it is safe, and the risk of transmission is extremely low, that individuals may be able to interact with other individuals who've been vaccinated with no mask or any distancing restrictions. This also goes for people who've been vaccinated going into the home of someone who's unvaccinated, as long as they are low risk. And low risk is essentially anybody that may be healthy with no underlying chronic conditions, that there is no need to engage in mask or distancing. And when it comes to being exposed to individuals that may have had COVID-19, is you really have to wait. There's no need to quarantine, and that you don't need to get tested unless you develop any kind of symptoms. So that's moving forward after getting vaccinated. And that's really the key point here, is individuals who do get vaccinated do have more liberties in terms of engaging either family members or outside homes that are vaccinated. The liberties are there to extend this a little bit more. So I wanted to give people some insight into what's going on, particularly here in Wisconsin, with regards to single dose vaccinations. So here is the profile as of yesterday. 26.3% of the state, or 1.5 million people in the state of Wisconsin, have now been vaccinated. When you look at this table on the bottom, you go left to right. What I do here is I list out the aggregated total of vaccines by race and ethnicity. So you see March 10th, 17th, 24, and then you see, let's say in the top row, American Indians, That's how many to date have been vaccinated, at least with a single dose. That next group of numbers is telling you the change, the number of new individuals vaccinated in the past week, okay? So we see that on March 10th, there was 2,000 natives vaccinated. On March 17th for the week, 1,700. On March 24th, it is just under 1,600. So in the last 3 weeks, you kind of see a trend that it's going down. And that's what I pay more particular attention to, is the trend. Not so much the number of the day, but what's the trend that's going on. And my concern is when we start looking at all other races and ethnicities, their trends are going up. At the same time, native trends are going down. And so this is going to be a bit peculiar going into the next 2 or 3 weeks, because if the trend continues, we will see that rate of increase of native people being vaccinated start to go down. We're already starting to see it, at least I am. If we look to the right of this table, we see the rate of increase from a single dose. So in yellow, you see March 17th, March 24th. We see that the rate of increase has actually peaked. So on March 10th, we see 1.9, March 17th, 2.2, March 24th, 2%. That's the rate of increase. So it is conceivable to say, have the natives in the state of Wisconsin peaked in its rate of vaccination? And it's quite possible. And that's why events like what we're hosting today are so vital. Not just, looking at numbers, but when we look at it overall, we're looking at families, we're looking at individuals, families, and really looking at getting back to a normal way of living. And that includes our traditional activities and our social gatherings. And this rate of decline worries me moving forward, particularly when we go into April. Is this a trend that's going to continue? Will it be steady? And that's what this event here is to offer, not only the opportunity and access, but also to kind of further the effort to assure that natives have access to the vaccination, to the vaccine. This is 2-dose vaccine. This really doesn't tell you a whole lot, but it does tell you kind of what the trend is in getting fully vaccinated. So on March 10th, 1% rate of increase, March 17th, 1.6. It is, in the past week, it has gone down to 0.9. The rate of increase is 0.9, and that's consistent with the trend of the single dose. You get 1 dose, you get the follow-up dose. So the trend is sliding, and that's worrisome to me. And I'll explain why here in a second. This is the state of Wisconsin. You see the bar graph on the bottom. March 24th, there's been 2.4 million doses administered. That is about, on the average of about 50,000 doses per day over the last week. So that has been going up. We look at the national rate of infection, vaccinations going on. We have now administered 130 million doses. We see the rate of vaccinations, at least by single dose. Individuals ages 65 and older is now 70.3% single dose, 43.8% for fully vaccinated. We are now averaging about 2.5 million doses per day. And when we look at long-term care facilities, we see that that trend is starting to decline, where the average is now about 14,000 per day. And that's what we would want to see. And it's really telling us that they are starting to reach their ceiling of administering the vaccine to our elder population. We look at how distribution and administration is going by state or by jurisdiction.
IHS is sliding a little bit in their rankings of 24 out of 64 jurisdictions. Wisconsin is now at 18, Minnesota 23, Michigan 43. They've been pretty steady at that pace, but you can tell that the the Bemidji area, that is, Michigan, Wisconsin, Minnesota, we've all these areas have been pretty consistent in its kind of position and its administering of doses. So looking at what's going on in Indian country. So aggregated tests, total tests up to date, total positives by region, and what March 23rd in the past 7 days, what the number of new cases have been. The highlighted area, and this is why I bring that trend of vaccination here in Wisconsin. We see that the only highlighted area in yellow is Bemidji, and that's essentially Wisconsin, Minnesota, and Michigan, 111. So that is kind of an uptick. Everyone else has remained pretty flat or slowly declining. But when we look at it overall, this past week, just shy of 700 cases in IHS. Again, that is the 10th straight week of a downward trend. And so the trajectory is definitely going down. However, I am concerned about the Bemidji area, and I'll show you one more slide that can show you why that is. So this is looking at the respective tribes of each state, Michigan, Minnesota, Wisconsin. We see that in the state of Michigan, there's been 75 new cases in the past week. Minnesota showing 114 new cases. Here in Wisconsin, believe it or not, there was only one new documented case of COVID in the past week. So we see the rate of infection by population. But again, when we look at Bemidji, one of the reasons why our area took a bump is we look at the state of Minnesota. That is a pretty significant increase even for Minnesota, 114. So kind of getting to the punchline here, why vaccinations are so important, in particular in our region. So this is Wisconsin state data, looking specifically at the age groups of 60 and older. We see the rates of infections that are going on. We see that over the last 3 weeks, the rates of cases are decreasing in the 60 and older. The rate of hospitalization is decreasing. The admission rate for ICU has taken a slightly upward turn, while at the same time, the rate of fatality has gone down. So this is kind of a mixed picture, but again, it just continues to hammer home the notion that vaccines do work. They are safe, they are preventative, and we're still looking at assuring that we take care of our elders that are 65 and older, and that we start insisting that that individuals do get vaccinated. So kind of a very whirlwind effect going on right now. Again, this is looking at the state of Wisconsin and the rate of single dose infections. When we start talking about herd immunity, heard experts say it's anywhere from 65 to 80% of the population needs to either have had it, and that's the important point. People who have actually had COVID, either by test or asymptomatic or by vaccination. So when we look at this graph, this table of data points, if we look at March 24th, at the very bottom left-hand corner of the table, we see a 50%. So some of the latest research that's out right now is saying that the rate of asymptomatic infections may be as high as 50% higher than the confirmed. Now, if that's the case, we're looking at possibly the state of Wisconsin having at least almost 16% of the state has either had symptoms of COVID or asymptomatic COVID infection. Now, as I mentioned, herd immunity, 65 to 80% for these infections to dramatically go down and out of people's community. That would mean that 3.6 million to 4.5 million people would have to have had either had COVID, either with symptoms or asymptomatic, and with the addition of the vaccinated group. Now, so that estimate is about 2.3 million Wisconsin residents either have been vaccinated to date or have had COVID with that 50% mark, at least 2.3. That means 1.3 million to 2.1 million individuals are left to get vaccinated as of right now. At the rate of vaccinations we're going right now, we're looking at anywhere from 30 to 45 days before we could possibly reach that herd immunity. That is if the rate of vaccinations of 50,000 per day continue as it is. It would take us about 45 days to get to that point of herd immunity. So where is that from here? April, May?
Mid-May.
We're looking at May.
Good to go by Memorial Day.
Memorial Day. So that's the kind of time frame that we're looking at. If people are trying to get an estimated sense of time here, we may be looking at mid-May as kind of that point of reaching that herd immunity level. So that's quick math that I've kind of figured out to help people kind of figure out where we are now, what they could do to help themselves and their family, and what they could anticipate in the next month and a half. So what I'm going to do, Mark, is I'm going to turn this back over to you and Jeremiah. I'm going to change seats. I'm actually in the
31 question.
Oh, question. Yeah.
So what happens if you have an exposure between your first and second shot?
I wouldn't look at quarantine. I would just, if you develop symptoms, I would then look at getting tested and going from there. If you do get tested, you will have to quarantine. But right now we're looking at individuals who are symptomatic.
So Dr. Ignace said, good to see you, and you're surviving this particular sleepless time for, I'm sure, you and staff at the health center. So thanks from me. I got a question, and this was a really good one. And we did see figures come out, the White Earth Powwow, and this is for all of our relatives that are watching this right now.
Mm-hmm.
There are powwows that are being scheduled right now. And there's a couple that are indoors coming up within a week.
Mm-hmm.
The White Earth Powwow held their shooting star event at their casino, and it was indoors on March 6th through 7th. And now we're seeing an uptick in COVID-19 related, there's a growth of COVID-19 in Minnesota itself and in that area, south and north. So I know we can't make a direct correlation to that event based on the numbers. That would take some serious investigations. But is there a possibility, based on how virus is transferred and the time that it takes from infection to presentation, could some of those cases be in the numbers that you're reporting? Because if that infection goes between that maybe 4 days to a week or two after, that's the 12th through the 21st.
Right.
So those figures coming out of Minnesota are remarkably high. And the reason why I ask this is we, as members of our tribes, need to be talking about this kind of thing if there can be a correlation that at least logically can be made between super spreader events
Mhm.
and our population. Any thoughts on this one?
So we know just the time frame between direct exposure and infection anywhere from 5 to 7 days, maybe as high as 10 days between event and exposure to when you start developing symptoms. Now, you had mentioned that whether or not there was a direct correlation between that event or what's going on in Minnesota. Well, that's why one of the reasons why I kind of highlighted this PowerPoint slide is that in the state of Minnesota, what was unusual as far as trends that were going on in Minnesota is that they had a pretty big spike in new infections in the past week of almost 115. Now, whether that's directly linked to that event or just the sense of well, 115 is in Indian country is a big number. That's a big jump. And so could that have been the direct result of that event? It's certainly possible. We know that there was a mini outbreak, and that little mini outbreak can lead to many others. And so kind of in an exponential growth. So it is certainly possible that that event is going to allow this virus to linger on more within those communities. There was a second part to that question, Mark. I missed that.
Yeah, the second part to the question is, is it within the realm of possibility that what happened at that powwow is in the figures you just reported out? And I think you addressed that, meaning that these reports are a little bit delayed. So we're looking at something essentially in hindsight, essentially, and certainly it's in the wheelhouse of those primary and secondary infections as that COVID-19 begins to spread to Indian country.
So this is that perfect time segue between the March date that you gave to when right now, because this is actually looking at what has occurred in the past 7 days, not today, but in the past 7 days. So what is today? Today is the 25th. So as far back as the 18th, that is kind of that tail end of that powwow event to when we would actually see an exponential growth as a result of that event. So this is the time frame to actually look and see that.
So I'm glad we're bringing that up. So to each of you that are here listening, please be speaking about this to our tribal leadership. Please, again, this is science, this is information. We need to apply it to our communities. Now, here's some numbers that are difficult to relate, but I'm going to do that to you. And I know at one time here in Milwaukee, folks would talk about us being at 8,000 tribal members in the Milwaukee area. 2016, there were 7,313. And then here in our 2021 census, there were counted 3,540. So almost, less than half. So I think we know that Native people, there isn't less than half that lived here since 2016. But it does affect funding. It does affect health services for our communities. And looking at what's been happening, if my numbers are right, you've vaccinated pretty close to or just above 4,000 people. Is that right? Coming through?
Well, no, not quite that. We're looking at closer to about 2,000 individuals after today.
So what number, as an Indian Health Center here in Milwaukee, in that native to native conversation, getting out the families, what's the number that you would want to see and feel better about what's happening in our community?
Honestly, I would like to see about probably about 2,800 of those, because those would be adults, not including children less than the age of 18. But if we're looking at like fully vaccinating the Native community here, we're probably looking at close to 2,800 individuals. So what we've been able to do up to this point, at least in Milwaukee, I feel pretty confident that we will after today, we'll have vaccinated probably close to 65% of all natives vaccinated here in Milwaukee were the direct result of good.
This question is coming from that a lot of my contacts are kind of in different places in the workspace. And this one's coming from that white collar category that we have in our community, the university, the office types, the folks that are working on computers. They're looking at travel once again in their jobs. And some of that is it safe to fly after they've gotten their second shot? Now, I'm just talking specifically about the shots you've been giving at the center. That native person's come through, they've gotten their second shot, and they're thinking, okay, now I am one of the first folks, and there's a competitive advantage in their workspace to get up and in the air and out to their clients that are around the country and in different parts of the world. Any advice or insights that you could offer that group of people looking to fly that have been through this vaccination regimen at Indian Health here in Milwaukee?
Sure. So we know that even if individuals got one shot, I'm not recommending people just get the single shot of the two vaccine, completion, because it's only giving you partial immunity by doing one shot. I mean, it is effective. It doesn't give you the full effect of the vaccine. So you need that second shot. So once you get that second shot, the general sense here is 10 to 14 days after your second shot that you will have maximized that level of immunity ability. So I would say 2 weeks after your second shot, you will have a better sense of taking liberties in traveling and feeling confident that you are safe and an optimal level of protection after your 2 weeks after your second shot.
We know that here in Milwaukee, there is a lot of nightlife that happens, especially downtown. Those places are talking about springtime events where they're going to have bands out in the street near where the Milwaukee Bucks play. So I'd say that after that 10 to 14 days, you got your second shot, and you're going to go out there and mix in public. Should those folks still be wearing their masks? And if you recommend it, why should they? Or are they good and they don't have to worry going out into that kind of public event?
Yeah, so it is recommended that individuals continue to have some face covering even after their second shot. And it really is, so there's this question that's out there whether or not getting vaccinated will prevent you from transmitting any virus. And Israel has come out with some pretty significant studies that certainly clarify that answer. And the answer is yes, there is a reduction in transmission of individuals who've been vaccinated of the virus. Now, they may be carrying a low volume, a low threshold, but it's not causing them to be ill, okay? And their risk of transmitting that virus, however low it may be, it's still present, but it's not like anywhere from 85% protection in transmitting the virus. So there is a chance that someone could, even after being vaccinated, could transmit the virus. It's likely, but again, wearing masks helps reduce that risk even more. So it is still recommended people who get vaccinated, second dose, 2 weeks, that you continue to wear your face covering.
So the next question, and this one is about not just a face covering, but all right, what do we do next? Meaning that person gets the second shot, and you see people over this time as a doctor, a healthcare professional. What is it that you would like to see our population, our native population, start to be doing after they get that second shot? They do that 10 to 14 days. Have there been areas of oversight by our community, by healthcare checkups or working out, or what kind of things are you seeing that you as a doctor would like to see us doing health-wise after that second shot?
I think, with that second shot, I think, being able to interact even amongst your own family. I know that's going on now, and if you think about it, the probability of risk of transmitting goes up every time before the vaccinations came. Now that vaccinations are here and people are getting vaccinated, there are people that should feel a lot more comfortable interacting with individuals after being vaccinated. And with that, it does, as social beings, we enjoy being with, interacting with people, engaging, socializing, and that's really the kind of level we want to get back to. The unfortunate part of this is that we may be wearing face coverings for a while, but I think people should have a sense of confidence that the level of protection for themselves or even the people that they are engaging with, the risk of infection goes dramatically down. Unfortunately, it's not absolute, it's not zero, but the risk is much, much lower than it was even 3 months ago.
So Jeremiah did ask that I be kind with your time and that we do an abbreviated show today because of the number of folks coming through the healthcare center. So this will be my last question, and you'll have the last word on this one. And this one comes from a parent over at Indian Community School. And this one is about childhood vaccinations. Do you, in reading medical journals, having conversations with other professionals, anticipate that there will be a widespread campaign for childhood vaccinations, and will children be required to get them before they start school next fall?
Yeah, that's the $1 million question right now, and the only evidence that would suggest there are anecdotal trials going on right now. The FDA has not been presented with Moderna, Pfizer, or any other vaccine information about childhood immunizations right now. The data isn't there, but what I am sensing of hearing of key individuals is that the safety profile is looking good, which tells me that at some point here in the near future, maybe even during this summer, that we will finally get that answer. Are vaccines safe for kids to get? I have a sense that it will. I can't tell you the time frame, and I don't know the age range either. So it may be like 8 years old and older. I don't know, how low they're going to go. Now, if that is data that supports the effort to be immunized, will this be a prerequisite to going back to school? That's going to be another hot debate to go through, believe me. Because you may have a general sense that we know that kids who do get it, they have maybe colds at best, 3-4 days, and they get over it. And as all the information I've been giving you, the data doesn't support that they get severe disease. On rare occasions, yes, they do get admitted to the hospital, and even rarer do they get admitted to the ICU. And so infrequent do they have a poor outcome. So it's I think when we talk about COVID in the pediatric population, I think we're so inundated with information about COVID right now, we kind of forget what was the impact of flu in our pediatric population. And I think I presented this once before, where we know that seasonal influenza has had a much more dramatic impact on pediatrics than it does with COVID. And with that being said, yes, we've vaccinated, kids for the flu, and we still have the numbers that we've had with flu. Is that the same kind of logic that we're going to have with COVID? And I don't know. I don't know. It's going to be an interesting discussion that's going to happen. I don't have that answer right now because that is really premature to start talking about vaccinating kids when we don't even have approval to vaccinate.
So, Dr. Ignace, we're gonna send you back into that den of work that's waiting for you out there, and thank you for the efforts that are going on and continuing. So you have the last word for today, and again, thank you to each of you that had that good patience, that waited that extra 15 minutes for us to come on. That tells us this information is important to you, and it's important to your relatives that don't have the ability to be on this program, and that we take some lessons away from our neighbors to the west out there in Minnesota, and we apply those lessons in Wisconsin. This is serious business, and we need to do things smartly. So that is it from me. Dr. Ignace, your last words for our program today.
Thanks, Mark. I appreciate the comments. They're really important. And I just want to take this time to, our health agency, our urban health center, has put in countless hours into putting on these vaccine events. And it may seem like I am harping on the community to get vaccinated. And I want to flip that, and I want to thank all of the Native community members. Either they live here in Milwaukee, in Chicago, Green Bay, Madison, throughout the state, who have come, who may have heard about this event and have gotten vaccinated. I want to thank you. Thank you tremendously, because as a Native physician who's gotten the vaccine, I understand how important it is, not only for the safety, but also the prevention of infections, of this particular infection, to not only my immediate family, but also my extended family. And so I want to thank everyone who enrolled, registered, persistently called us to get a vaccine. I'm just grateful and appreciative of the Native community responding to our call for this event. So thank you very much. I'm taking a break next week. I'm taking 5 days off, and I want to let you know that we won't be having town hall next week, but we will the following week, and I will be keeping track of the trends that have been going on. So when I come back, I will be trending out the next 2 weeks and see how, and let everyone know how things are going in the Bemidji area. So Jeremiah, thank you for letting me use your office. Mark, thank you for being patient. And I want to thank all of the Native individuals who came to get their vaccine through us. Greatly appreciate it. And I know your families will thank you as well. So until next time, people, stay strong and take care.